So welcome back. We are going to look at the practical issues that we can face in the practice of public health and how we navigate those practical situations. So let's start with one major issue, which is individual versus public good. This is often explained in relation to contagious diseases that can spread from one person to the other. And a very good example can be obtained from what happened during COVID-19. The first person who gets a disease, a communicable disease, usually in epidemiology, we call that person an index case. So that person who is the first person get a communicable disease, they have rights. So we call that individual rights. So they have their own rights. They have rights to talk to whoever they want to. They have rights to move whatever they want. But if they do that, they are going to put the community or the population at a risk. And usually we have to isolate these cases. So the isolation of these cases means that you are actually violating their individual freedoms and liberties. But you're doing that in order to protect the population. And especially in conditions that are very contagious and can cause a lot of public disorder. Mute. All right. So you don't want these people to be spreading the disease to the population. So you want to keep the population safe from the contagious disease. So you isolate these people, but when you do the isolation, you're infringing on their rights and freedoms. But since you're doing it to protect the public, that's okay. Then the other thing is that also relates to protecting the public and restricting individual liberties, relates to people who are driving. People who are driving. You want people to put on their seat belts, okay? And they should drive carefully to protect other members of the public who are using the road. But as you're doing that, you're actually infringing on their freedom, yet the interest is on protecting the public. Okay, so those are examples where we have individual versus the public good as related to public health ethics. Someone is asking a question. Okay, Anya is saying that the internet is not good. Is anyone experiencing the same problem? Is there someone saying that my voice is not very stable?
I can hear you now.
Okay.
I don't know.
I want to confirm from someone else. Is there someone who is saying that, yes, your voice is not audible because of the internet, perhaps? I want to know whether it is a general problem or it is just Annual with the problem. There are people who are always quiet on this group. Galaxy 10, Galaxy 9, Samsung. I don't know who you are. And then there's someone who has not put the name for their. Only two people have put names when you're joining it. I cannot call you by your phones. You need to put your names. When you're joining, you say, you put your name there, such that I can know who you are. But you're also keeping quiet. One was or what? I want to confirm that I can.
Yes. Yes. Galaxy 10A is or what?
So why don't you put your name there? You don't know how to put your name? Or what? Can you hear me loud and clear?
Sorry.
Confirm that you can hear me loud and clear.
Yeah, I'm getting you clear.
All right. That's very important.
Yes, loud and clear.
All right. Good. So let's proceed. I know the problem could be with your internet that end. So let's move. The other issue is related to health communication. Health communication and health promotion usually are similar aspects. So when you are sending a message to people out there about a health behavior and you want them to change, you need to be very careful in crafting that message, because there are possibilities that the message can be very sensitive and actually violates cultural norms and practices of a particular community. So you need to be very careful, but also don't send messages that perhaps will infringe on people's privacy. So be very careful in crafting those messages. They should not be messages that evoke emotions, can have negative emotions associated with some messages. So need to be very careful in crafting health messages. Okay? Make sure that you're thorough with your health message and you have not left out any messages or any omissions. Generally, you don't want to do something bad. Okay, you don't want to use words that are not good. You don't want to stigmatize. Okay, you don't need to use words that are actually portraying certain people in a negative way. So you need to be very careful. Always do the good thing. Don't send messages that are sexist in nature. Okay, that is not something that you can actually do. Avoid that. In all communications, you'll be involved in communications, whether you're crafting an announcement or an advert about an outbreak of a particular disease. You need to be ethical in your communication. Be truthful. Make sure that the message is complete. Be sincere. Say what you know, and if there are things that you don't know, then say that you don't know. Okay, be inclusive in your messaging. Then coming to infection control, we talked about this in relation to COVID-19, isolation and quarantine. These usually are associated with limiting people's liberties and freedoms. So there are ethical issues there, but also collecting information about people. it also poses ethical issues in regards to you accessing people's private information and using it for different purposes. So surveillance has issues to do with privacy and also sharing that information with others is another issue. Someone is having a message here. Yes, Charles, you can attend if you want, no problem. Okay, so the other issue is restrictions on international travel, or especially in the context of communicable diseases like COVID-19. If you don't allow people to move freely because they are going to carry a contagious disease, that is an ethical issue because you're violating their rights to free movement. We have diseases that you need to have documentation of vaccination if you're going to travel to other countries. Different countries have different requirements. I think South Sudan has the requirement for yellow fever. You need to have the yellow fever vaccination card with you for you to come to South Sudan. So making sure that people don't enter your country if they are not immunized against certain conditions is an issue that can have implication of human rights and freedoms for movements. But we also have issues where schools were closed. Closure of schools has it had ethical implications. One is that we really did not understand whether closing the schools had positive or negative impact. Now, was closing schools the best thing to do? If it was not the best thing to do, it means that you put people in danger deliberately. We had what we call the shadow pandemic. Shadow pandemic meaning that as the pandemic was going on, other problems were actually increased in the background. So what we call it a shadow pandemic. So issues of I was explaining a concept of the shadow pandemic, which is that when schools were closed, a lot of other social problems emerged. Okay, yet we closed schools not having, or when we didn't have enough evidence whether closing the schools was the best thing to do. So what were the things that happened? There was increase in domestic violence. There was increase in the number of teenage pregnancies. And eventually we had an increase in the number of school dropouts. And then we had problems of learning not taking place. We lost time in terms of learning, okay? So that is an ethical issue because your interest is to protect the public. But when you decide to close the schools, you are not actually protecting the public in other aspects. Okay, for example, in the cases that I've just talked about, increase in domestic violence, child dropout, increase in the number of teenage pregnancies, early child marriages. So the problems were actually created, yet we are supposed to avoid problems or risks. For example, as the principle of malnutrition talks about. Okay, so those are issues that are associated with infection control and as manifested during the COVID-19 pandemic. Okay, so we move forward. The next thing that happened during COVID-19 is If you are a doctor or if you are a frontline health worker, a person who is serving during COVID-19, are you willing to put yourself at a risk and contract COVID-19 and possibly die, or you could rather leave the profession? Those were questions that were emerging. So what would you do? That's one scenario. The second scenario is, are you going to avoid prescribing certain antibiotics because they are going to cause antibiotic resistance? Yet these antibiotics could actually save a life if you prescribe them. Another issue is an issue of privacy in HIV. Okay, you are taking care of a patient. The patient is HIV positive, but does not want to disclose to the partner whether they are positive or not. Okay, so as a health worker, do you disclose to the partner that your spouse or your partner is actually HIV positive? You need to take the test. So those are issues that are related to clinical practice and also ethics. Okay. So we move to the other concept, which is vaccination. Vaccination ethics. A mother brings their child for vaccination. The child is underage. The child cannot make some decisions. So the parent makes the decision on behalf of the child. What if you have a parent refusing their child to be vaccinated? What are you going to do? Okay, what are you going to do? That's a problem that you will encounter. The mother is refusing their child to get vaccinated. Okay, so what are you going to do? Let me pause there and ask. Anyone who's going to try that? The mother does not want their child to be vaccinated, but you know vaccination is very important. Yes, Charles? Yes, go ahead.
All right, thanks so much. One thing you need to know about that person is to know about, to understand the level of knowledge the person is having. Secondly, you need to know the attitude and the practice. So when I talked about knowledge, at times that parents might not understand the importance of immunization of vaccines. Secondly, about attitude, maybe from their village or from their area, issues to do with immunization, maybe it was wrongly, maybe worked on to another child that led to death or other issues. Then practice, maybe in their culture, they don't do that. So if such thing happen, you as a worker, you need to understand all those aspects. Then you can, if the person do not have the knowledge, then you need to give the knowledge on the importance of immunization. So by that way, the person will come to understand that this thing is very important, and he or she will start bringing the child voluntary to the health facility. Thank you.
All right, thank you very much. Yes, there was another hand. Ange?
Yeah. Yes, thank you.
Thank you so much.
I'm going to go first, and then I'll watch you on it. Yes, go ahead.
Yeah, thank you so much. I think what my colleague had said, it was what I wanted to say. Maybe what we do with that mother, you first counsel the mother and tell her the importance of getting the vaccine. Thank you.
Oh, thank you. Yes, or what?
Yeah, thank you. I think what my colleague has stated are all correct. The first thing, understanding the knowledge level, and then after understanding that, then this mother need to be counseled on the importance of these vaccines. Then I hope if she's counseled, she can able to accept this. So the most important thing, counseling, and if the knowledge gap is the whole community, so it need more engagement, community engagement meetings, and then health education at facility level, so that the community can able to pick up from there. Thank you.
All right, excellent, thank you. All right, thank you very much for everyone who has participated. Yes, there is need to change attitude. This case will require engagement, allowing the mother to verbalize their fears, and also you listening and understanding. This is where communication becomes very key, such that they can get such that their fears can be validated, and that they feel that they have been listened to, and then perhaps they will change their attitude and accept the vaccine. So the tendency for people to refuse vaccines is actually not a problem only in developing countries, even in the US. And that concept is what we call vaccine hesitancy. So we still have a vaccine hesitancy in also in developed countries. So it's very important that you understand the dynamics related to ethics and vaccination. Okay, so we move to the next slide. The ethical perspectives on social determinants of health. Social determinants of health means that the conditions of where we live, we work, where we are born, they influence our health. If you're born in a place, in a poor neighborhood, the chances that you will have all these diseases, communicable diseases, because of poor sewage, or you don't have access to clean water, sanitation is poor, ABCD, the schools are not the good ones, all the things will eventually impact on health. So the emphasis in public health is that if you want to improve people's well-being, then focus on improving the social determinants of health. Okay, for you to achieve health equity, people are actually having poor health because of poor living conditions. So it is better for you to put resources that uplift people's lives than perhaps using the resources for treatment. Okay, for you, instead of making sure that people have pit latrines, such that the environment is safe and there are sanitary facilities, you are interested in buying the warmers. You're interested in making sure that there is ORS. The problem is in the community. So focus on those determinants of health. When you focus on them, then people will not come with diarrhea, with all this worm infestation. So that is the current trend, that if you're designing, if you want to improve people's health, focus on social determinants of health. I think this is what we had discussed. And then health research. Those of you who missed the Nuremberg Code, which discusses issues of informed consent, and making sure that people's rights are are protected, privacy, confidentiality, and others are very important in public health research. Palliative care, which is caring for people who are having what you call terminal illnesses, people who are actually going to die because of their condition, which is in terminal stages. These people usually need to be cared for, and that care is what we call palliative care. What does palliative care involve? It involves making sure that people have a pain-free death. So they are provided with comfort, with pain management, and also management of symptoms. Okay, so if someone has, for example, advanced cervical cancer, stage 4, for example, then death is imminent. But because they have this cancer, you don't leave them to die with this painful experience. You manage the pain. You manage the side effects of the medications. You manage the hydration. You make sure that they are comfortable. That is what we call palliative care. So as a public health professional who is in charge of allocating resources, are you going to put resources on curative care or palliative care? Curative care is care that is making that is aimed at making sure that people recover. Let us say from malaria, from typhoid, whatever it is, that is curative care. Palliative care versus curative care, where are you going to put the resources? Are you going to put the resources on people who are going to die, or you're going to put the resources on people who are most likely going to survive? Let's answer that, then we proceed. Yes. Who is opening the mic first? Yes, go ahead. The person who has
I think you'll put on curative care. Curative, somebody who will survive. That is when you put resources on.
Yeah. Most likely, that is what decision makers will do. For example, in South Sudan here, we don't have organized palliative care. Organized, when I say organized palliative care, what I mean is that in the hospital, you can have what you call palliative care physicians. These are doctors trained in palliative medicine, palliative care nurses. There is a palliative care policy. There is palliative care training. Okay, I don't think there is any institute in South Sudan currently teaching, let us say, palliative care nursing as a course, not there. So you see, there are no structures related to palliative care, whether they are policies, whether structures, whether enumeration, or whether recruitment. Basically because as the decision makers, you look at the options, what are you going to do? Whether palliative care is very important, you also want to have curative care. And that's why most developing countries don't have palliative care hospitals or even clinics. So in the whole country, I don't think there is a palliative care clinic in South Sudan. I don't think there is one. Those of you who are very much interested in exploring, this could be an avenue. Palliative care clinic, a private one. People who have terminal illnesses, they can be referred there, and then you take care of them until they pass away peacefully. Okay. So we move to resource allocation. Where do you put money? I think across our discussions in the previous slides, you can see that we have been talking about this a lot. But the emphasis is on ensuring that you don't discriminate. make sure that everyone within the population is having equal access to resources, okay, to healthcare resources or access to healthcare. So you address issues to do with health disparities, which is that you don't want other people to be better than others. At least they should be having similar health outcomes. So it is very important to know that there are people who are worse off and they need a lot of resources in order for you to uplift their health outcomes. So those are principles related to what we call distributive justice. Resources should be distributed equitably and based on the needs of the population of individuals, regardless of who they are, where they are from, whether in terms of gender, race, or any other characteristic that can be discriminatory. So we move to the next, which is still under the use of resources. You don't want to misuse resources. You want to put resources on interventions that are very impactful. Okay, don't put resources where they will not have a lot of impact. Who is going to benefit from them? Make sure that there is efficiency and effectiveness in the use of resources. Okay, so maximize benefit, maximize effectiveness. Don't misuse the resources in any way. Evaluation, you will carry out a number of public health evaluations. When you're carrying out evaluations, you're going to collect data. This data usually is associated with infringing on people's privacy and confidentiality. But you need to be mindful of that when you're collecting this data. We have what you call ethics in policy. This is to say that when you're enacting any policy, there are usually implications associated with those policies. But the emphasis is that look at who is most likely going to be affected by the policy and who are the people who are vulnerable and that may be negatively impacted by the policy. Look at those issues and answer them. Now, the last slide here talks about ethical leadership. It's very important in your conduct. For example, you're in charge of resources, don't embezzle resources, don't corrupt, don't be a corrupt person, be a person who is transparent, accountable. You have a culture of integrity. When you do that, people will trust you with their resources. Even the community itself will trust what you're doing. So that marks the end of this presentation, unless you have any specific questions.